SBIRT is the program that we're utilizing here at the University of Maryland, and it stands for Screening, Brief Intervention, and Referral to Treatment. This is a concept that's been utilized in other disease processes, but really addiction is its primary usage. What we do here is our nurses, when they're doing the triage process, they're screening the patient, so they use a simple tool to screen, and you're casting a wide net. So you want to try and make sure that you're capturing everybody that you have the potential to impact.
We don't wait for cancer patients to hit stage 4 before we decide to treat them. We don't wait for someone with diabetes to be in a coma before we decide to treat their illness, and it is the same for addiction.
If somebody screens positive, then we move on to the next step where we do that brief intervention and find out what the patient is receptive towards receiving, and if they can benefit from treatment, then we try and provide that referral to treatment.
The earlier you identify someone with a problem and engage them in treatment, the lower their mortality rates and the better the chance they have of gaining a long-term recovery.
This is why intervening in the emergency department is so important. This is an opportunity that we have to intervene with a patient that's at high risk. So a patient that comes in with a non-fatal overdose, we know that research has shown that they have the highest likelihood of having a future fatal overdose. So if we can intervene at that critical time, then we have the possibility to save a life. So not pushing it off to some other provider and taking ownership in the emergency department is really important.
I think the major reason that addiction is not treated like other diseases that we see in the emergency department is the stigma that's been associated with it, the component where we tend to blame the patient as if it were part of their control.